onto Pennie's. We'll have it recorded and posted on Pennie's YouTube page, and we'll have it there as a resource for everybody here in the sister community. I see Denise is coming in. Kelsey is going to monitor our lobby, so folks, as they come in, they'll be admitted. I'm going to go ahead and get started with the presentation. As I said, this is going to be recorded. So with that, I'm going to go ahead and kick things off here and just welcome everybody again to our October A Sister Lunch and Learn. What we're going to cover today is pretty straightforward. We're going to cover our road so far, where we were in terms of open enrollment 2021 and the COVID-19 enrollment period. We're also going to be taking a look at some key dates and some updates for open enrollment of 2022. I would like to start off by just thanking everyone in the Assister Network for what has been a tremendously productive year in 2021 through the closing of open enrollment for 2021 in January and through the COVID-19 enrollment period. There was a lot of positive work done, not only through our Assister Network, but through our broker partners and through our community partners in helping people here in the Commonwealth of Pennsylvania get protected. And coming out of our first open enrollment, these were basically the high level results. As you recall, or as you may recall, when in November of 2020, man, that seems like 1,000 years ago, doesn't it? In November of 2020, when we launched Pennie, we had about 280,000 human souls that migrated over from healthcare.gov to the Pennie platform. The good news is that our retention of those customers were it was almost 97%. It was incredibly high retention we had. But the great news is that we also had new enrollments to the tune of about 75,000. And many of those enrollments were because of the hard work and the dedicated efforts of our sister community across the Commonwealth. One of the things that I honestly was surprised to see was that as a fledgling health insurance exchange, we had such positive gains. Again, and this was also, as many of you know, here at Pennie, we have a no wrong door policy. We made sure that there were, on average, about 55,000 individuals through our inaugural open enrollment that if they didn't qualify for health insurance options through Pennie, that we got them referred over to Medicaid so that they could get the coverage that they needed. But again, what I'd like to focus on is the fact that we went from 280,000 Pennsylvanians to 337,000 Pennsylvanians protected through Pennie. And again, by and large, because of the efforts that take place in the hospitals, the health centers, the communities across the Commonwealth of Pennsylvania, metropolitan, rural, you name it. There was a lot of work that went in to increasing that number, and the lion's share is through the dedication that our assisters have in their communities, making sure that they are consistent advocates year-round, not just during open enrollment, but year-round. And again, this is something that we should all be able to celebrate. From an outreach perspective, Juan, Valencia, Emily Zido, and myself, we're three people. And boy, do we have a lot of wood to chop in Pennsylvania. And I know my colleagues get sick of me saying that, but we do. There was a lot of outreach activity through 2021, and it continues even to this day. Hundreds of virtual and in-person education sessions. We attended conferences. We attended town hall meetings. Our emphasis in 2021, and it still is one that will continue into open enrollment of 2022. From an outreach perspective, if you were to ask me right here, right now, have we done a good job in reaching hospitals and health centers in Pennsylvania? As the outreach manager, my response would be yes, but there's a lot more that we can do by way of working with our hospitals and health centers here in the Commonwealth of Pennsylvania. Again, we're only 3 people, but if we were to consider where the where the words "I don't have insurance" are most frequently heard, it's with our hospitals and health centers. Hence the reasons, that we we take great pride in our sister network and in having those resources in so many of our hospitals, health centers, and community centers across the Commonwealth of Pennsylvania. In terms of our outreach, of course, we've tried to actively engage the Hispanic and Latinx communities through the 222 corridor and in southeastern Pennsylvania, as well as Allegheny County here in the west. And we continue to work with and to better engage the LGBTQ communities, as well as the African American and Asian American communities. And just yesterday, I was literally talking about rural communities in the northern tier of the Commonwealth of Pennsylvania. I was up in Potter County, and trust me when I say it does not get any more rural than that. So again, there's a lot of work in front of us from an outreach and education perspective, but we do have our priorities. We are working with legislators, particularly the legislators here in Pennsylvania in both caucuses. And why are we doing that? Well, we're doing that because, number one, we don't want our legislators or even the municipal leaders here in the Commonwealth of Pennsylvania to overlook Pennie and to overlook how we have been able through Pennie to protect and literally improve the quality of life for so many thousand of our friends and neighbors. It's something that we need to continually make sure that they are aware of. Why? Well, the good news is, and we'll look at this here in a minute, but the good news is that the enhanced financial assistance that is available through the American Rescue Plan for 2021 and 2022, that's a discussion we need to have sooner rather than later, not only with legislators, but with anyone who has an interest in seeing people protected and done so in a manner that's affordable and of advantage to all Pennsylvanians. So that's part of the reason why our legislative outreach is something that we continue. And our partner, Eric Hewitt in the policy office, he's our legislative liaison here at Pennie. Eric and Emily and Juan and myself and Director Sherman, we do reach out to legislative staff and legislators here in Pennsylvania as often as we can, and we will through Open Enrollment 2022. We also have very, very good relations with the Pennsylvania Department of Labor and with the Pennsylvania Career Link system here in Pennsylvania. The reason being is because there are a lot of our friends and neighbors coming out of 2020 who they're looking for work. Some of them still looking for work. And depending upon what area of Pennsylvania you live in, the availability of employment it's challenging. There are a lot of individuals, especially in our rural markets, that They may have gone from working one job to working 2 or 3 jobs in order to support their families. They may not have access to employer-sponsored coverage anymore. That's a significant issue, and it's one that we're prepared to see through in open enrollment 2022. We're also working with small business owners here in Pennsylvania. We're engaging faith-based organizations as often as possible, because to be quite honest, sometimes that is the best way to connect with people who need health insurance the most. Um, and we're also, continuing to work with our YMCA partners on the Health Equity Tour. I mention all of that because also on this road that we're on, we can take a look at what our breakdowns are by sex and income. Our enrollments here at Pennie, we have more females insured than we do males. And if we take a look at the breakdown in terms of income, in my humble opinion, the sweet spot where we want to be aggressively, from an outreach perspective, aggressively engaging individuals is that, 100 to, 399, we'll call it, 100 to 399% of the federal poverty line. But Director Sherman, not long ago, when we were talking about how income is a factor here in the Commonwealth of Pennsylvania for so many, we can't forget about the American Rescue Plan and those individuals who are over 400% of the federal poverty line right now that, traditionally they're the ones to thumb their nose at the marketplace and say, well, I can't afford the insurance because I don't receive any financial assistance. I did speak to a gentleman yesterday, and I'd like to say thank you to Tia Whitaker for introducing me to this gentleman. Um, he provided me with some insight into a population of individuals who, through the American Rescue Plan, not only may find themselves in that 400% or more of the federal poverty line, but in a position where, again, like, most good, hardworking folks, they've done everything right. They save, they put money aside, they retire early, or find themselves in a position where, they're fortunate enough that they can do that. Healthcare then becomes, for anyone under 65 who falls into that 55 to 65 window, healthcare becomes a significant financial burden. I'm going to say it blunt as that, a significant financial burden for them. Through the American Rescue Plan, and this is why we should all be concerned about the continuation of it. 36%, and I'll show you the next slide where this really hits home. 36% of Pennie's customers right now here in the Commonwealth of Pennsylvania, 36% fall between 55 and 64 years old. So being able to provide options to individuals who, for all intents and purposes, should be enjoying their the best years of their life. We'll say that. Helping them see, helping them see a better horizon to that. We all have such good news to share, not just with individuals who, may not be eligible for Medicaid or CHIP, or individuals who might have lost their job and their employer-sponsored coverage, individuals who might be starting a business. For those individuals who are, a little older, who are, again, in a position where they've done everything right and they're retiring early. If they're not eligible for Medicare or Medicare options, boy, Pennie is definitely a breath of fresh air. And it's good news to share that, again, will empower individuals. And if you think about it from this perspective, It will empower individuals who have, uh, again, that income where they can do a lot with that extra income. And I'll just leave it at that. But from an economic standpoint, um, you know, uh, there's a tremendous impact that ripples far beyond, just providing people with affordable health insurance. And that could be said with every population that Pennie services. These uninsured figures, every time I look at this, I get a chill up my spine. But, roughly, there are about 607,000 uninsured in the Commonwealth of Pennsylvania. Okay. Um, what hasn't changed? Well, what hasn't changed since our last version of this heat map is Philadelphia County actually increased in the number of uninsured. Lancaster County actually increased in the number of uninsured. Still, between Bucks, Montgomery, Chester, Delaware, and Philadelphia, you're still looking at roughly 36 to 38% of the uninsured in the Commonwealth of Pennsylvania live in the southeast corner. Um, some good news is Allegheny County has seen a decrease in the uninsured. Um, Erie County has seen a slight decrease in the number of uninsured. So there are some positives that have come out of this. What I will say is, again, there's not a single county in the Commonwealth of Pennsylvania that is not impacted by having uninsured in their communities. And still, about 1 in 20 Pennsylvanians wake up every day, go out into our streets and our roads, our towns, our cities unprotected. And that it's sad because that's something that as a sisters, as well as I do, that's something that we can change. That's something that we can impact. Um, Speaking of impact, nothing in my recollection has had as tremendous an impact as the American Rescue Plan. Through Pennie's COVID-19 enrollment period, assisters and brokers across the Commonwealth were able to, again, insure thousands, tens of thousands of people. When it comes to the American Rescue Plan, the one significant thing to keep in mind is that those generous subsidies that we are promoting vigorously now, they're still going to be with individuals through plan year 2022. And going back to the importance of legislative outreach, to being vocal in your communities about the impact of that support, being like Tia and sharing the incredibly good news of the lives that have been transformed by, not only your efforts as an assister, but through the American Rescue Plan and being able to provide individuals with an incredibly new view on not only the importance of being protected from a financial perspective through health insurance, but about how access to that health insurance can not only protect, but also increase their quality of life. The ripple effects of this are not unidimensional. They are significant, and they are something that all of us should continue to be very strong advocates for through Open Enrollment 2022, but again, also in our various communities. Because, and T has heard me say this before, a lot of our sisters have heard me say this before, it is not one person that will transform this Commonwealth, move it to a better place. It's going to take all of us to do it. And in terms of the impact that the American Rescue Plan has had, I wanted to share with all of you this this interesting slide that sort of gives us a before and after. The important thing to focus on here is the fact that through the American Rescue Plan and through our COVID-19 enrollment period, we were able to add 65,000 new enrollments to Pennie. That's beautiful. That's 65,000 more Pennsylvanians who are now protected. Right now, because of the AARP, nearly 50% of Pennie's customers, our current customers, are paying less than $1 for their health insurance. About 68% are paying less than $50 a month for their health insurance. Truthfully, we live in incredibly exciting times. If health insurance and protecting people's quality of life is what matters most to you, now is a very good time to be an assister. Now is a very good time to be part of this new experience in the Commonwealth of Pennsylvania. And speaking of new experiences, I've got some updates for everyone. First and foremost, we want to take a look at the obvious. Our second annual open enrollment is coming. We have a couple key dates. November 1 begins all of the excitement for open enrollment 2022. For individuals who are seeking January 1, 2021 coverage, their deadline is December 15th. Okay. For individuals who sort of get caught up in the holidays and miss out, and boy, I hope people have a good time this year. Given 2020, we need better time here in 2021. If they miss out on the December 15th deadline, anybody from December 16th through January 15th, they're eligible for February 1 coverage here at Pennie. Now, on January 16th through December 31st, we're back to our special enrollment periods. Okay. If the individual comes to you and they say, I just lost my job, I just gained lawfully present status, whatever the qualifying life event is, we can provide them with health insurance options. That, again, most of the qualifying life events will open a 60-day window that'll help them or at least provide them with time for comparison shopping and putting some good thought into what they need. So I just wanted to make sure everybody was updated on that. We also have some updates here, some new things that are coming down the pipe. For open enrollment of 2022, our broker training is now free. Our assister training continues to be free. Through our website at pennie.com, we now have explainer videos, and we will be ratcheting up our use of videos more frequently. You'll also note that in addition to our assister lunch and learn and our broker lunch and learn sessions, we also have sessions that are being for community partners, and from a technical perspective, we have sessions that are being recorded specifically to provide folks with resources that they need. So that's going to be done through our YouTube channel here at Pennie. In terms of outreach, we are going to continue to elevate and increase our focus on folks that are disproportionately uninsured. And again, that covers the young invincible individuals, the LGBTQ community, our Hispanic and Latinx communities, as well as African Americans and Asian and Pacific Islanders here in Pennsylvania. And we won't forget rural Pennsylvania at all in those outreach efforts. Our assister network is going to grow here in OE 2022. And we've got growth in areas that are going to be aligned with helping Pennie better reach individuals that fall into those disproportionately uninsured communities. Good news again, with regard to carriers, we are in open enrollment 2022, we are adding another carrier. Cigna will be added to our health insurance carriers here on the Pennie platform. And here's some really good news. Every county here in the Commonwealth of Pennsylvania will have at least 2 health insurance carriers for open enrollment 2022. That competition in the marketplace, as you all know, is a good way to help regulate rates and premiums. Again, and I'm going to hit these. I will provide this deck to everyone, but I'm going to start hitting these very quickly. In terms of the Pennie application, we have improvements to the application. The customer application and customer facing notices are now in Spanish. Okay, we were working hard to get that taken care of over the past year. Previous year's applications, this is cool. Previous year's applications will be carried forward so that customers don't have to start over. Everybody likes saving time, including assisters. I know this. So when it comes to special enrollment period improvements, an income change will open an SEP when customers are newly eligible or ineligible for financial assistance. Okay. And an additional SEPs, including a COBRA subsidy expiration, exceptional circumstances, and exchange error will be newly available for customer self-service. Okay. Use of interface or user interface improvements. We've improved and simplified language on advanced premium tax credits in explainer and hover text. That's one of the things we love about Pennie is the platform actually allows and fosters education. It's built right in. And reported income has been added to the verification screen as a reference and reminder. Adjusted gross income functionality has been improved to streamline and simplify income verification. Enrollment improvements, customers with $0 premiums will not be prompted to pay now to avoid customer confusion. Sounds like a little thing, but sometimes little things can relieve a lot of stress, and we all know that. Brokers and assisters, their support line will be open from 8 a.m. to 5 p.m. on Saturdays during open enrollment. Okay. Here's an example. And many of you, if you go to Pennie now, you'll see that the application in Spanish is now available. I also wanted to mention we still, through our website, through Pennie.com, you have the ability to switch between Spanish, Mandarin, Russian, Arabic, and English, those 5 languages. From a support perspective, our customer service, our brokers, assisters, people will be able to send us questions through Pennie.com. You'll note that 844-844-8040 is open Monday through Friday, 8 to 6 p.m. And through open enrollment, it's Monday through Friday, 8 to 7 p.m. And on Saturday, 8 to 1 customer facing. You may be saying, but Scott, hold on. And yes, you're correct. For brokers and assisters. And I'm encouraging every assister, if you have questions, if you need technical help, go to 844-844-4440. Okay, that's where you're going to get tickets created and things are going to get resolved quick for you. Okay, but again, through open enrollment, 8 a.m. to 7 p.m., Saturdays, 8 a.m. to 5 p.m. How can you support? Well, order Pennie educational materials to be sent to your office. Okay, that's a huge help. You can do that directly through Pennie.com /materials request. Just let us know how much you need and we will send it to you free of charge. Facebook, Twitter, LinkedIn, if you can support us through sharing our content that we put out, that would be fantastic. And as always, you have the opportunity to join us for the Assister and Broker Lunch and Learns every 3rd Wednesday for assisters, every 3rd Thursday for brokers. With that being said, I see we're a minute over. I just wanted to thank you all for every great thing, not just good thing, every great thing that you've done in 2021 to help protect people here in Pennsylvania. I have little doubt in my mind that we are going to have an incredibly productive and to be quite blunt, an awesome open enrollment for 2022. In the couple minutes that we have, are there any questions? All right. Well, with that being said, again, I'm going to thank everyone for for showing up today and participating. This session will be recorded. When we have it ready, we will share it with the Assister Network. And thank you again so much for all that you do. And I hope that you have a peaceful day and a productive week. See you on November 1st. Thanks, everyone.